as the Health Secretary Steve Barclay meets unions later today. In the fervent hope of staving off strike action across the NHS, Labour have called for a radical rethink in the way that the whole health system works.
This includes phasing out the existing GP system and increasing the use of the private sector. Shadow Health Secretary Wes Streeting joins us now. People will be cleaning out their ears this morning, Mr Streeting, thinking, is this the Labour Party proposal? More use of the private sector? What on earth are you talking about? Morning.
Morning. Well, let's separate out those two things, Susanna. And we're talking about making use of spare capacity in the private sector for operations. We've got now the biggest backlog in the history of the NHS. That was already the case before the pandemic. It's even worse now, and the NHS is going through the biggest crisis in history because of Conservative mismanagement. And we've got a two-tier health system at the moment. Those who can afford to pay to go private are doing so, and those who can't afford it are being left behind. And what I'm saying is, as a temporary measure, a Labour government would use that spare private sector capacity to see people who couldn't afford it otherwise to get treated faster for free on the NHS in order to bring the backlog down.
So this is about commandeering private facilities, but still delivering them free at the point
absolutely.
that patients would use them.
Yeah, I'm absolutely determined to keep the NHS as a free at the point of use public service. I think that's the thing we all love about the NHS, but we can see that it is in a desperate state. And I really feel for the frontline staff who are having to deal with the consequences of this, just as I feel for the patients who are waiting longer than ever. And we've got to think radically about how to solve that. The last Labour government, by the way, used the private sector to bring down waiting lists at the same time as investing in and reforming the NHS. So by the time we left government, we had the shortest waiting times and the highest patient satisfaction in history. And interestingly, use of the private sector generally, private healthcare sector, fell off a cliff because the NHS was so good that people didn't feel the need to go private. That's where I'd like us to get to again. But we are thinking in a very hard-headed and pragmatic way about how we deal with this backlog, because I don't think that people who can't afford private healthcare should get left behind, as this government does.
It certainly conjures up some sort of dramatic and almost strange images. I mean, certainly, say, here in London, of people who can't get an NHS appointment basically getting a taxi to Harley Street and going in and seeing a Harley Street consultant. I mean, that's really what we're talking about, isn't it?
Well, I think it's about making sure that if there is spare capacity, and there is in the private sector, that we get people treated as fast as possible wherever that's possible. As long as we keep it free for the patient, that's the most important principle. As long as people are being seen faster and get better health outcomes, that is the most important thing for us to think about. But going back to Susanna's original question, we do need to rethink how we're delivering healthcare in this country, because one of the reasons our hospitals are blocked up is because the front door to the NHS is broken. In October, more than 2 million people waited more than a month to see a GP, and that's despite the fact that GPs are providing more appointment slots now than they did pre-pandemic. It's just that the system's broken. We've lost almost 5,000 GPs in the last decade. And just to be clear about what we'll be consulting on, we actually need more GPs, and Labour's got a fully costed, fully funded workforce plan to deliver more GPs. But we might want to change the way in which GPs are employed.
Yeah, it's not just GPs, nurses particularly feel exhausted. They say that the way to revive the nursing service is to give nurses a pay rise. Would Labour increase pay for nurses?
We've been very clear, be willing to sit down and negotiate a pay rise for nurses. We understand the pressure they're facing. I'm horrified, actually, to see nurses turning to food banks, NHS hospitals opening food banks for their own staff. That is how grim the situation is.
How much would you give them right now? Because the problem's now, of course.
Yeah, that's a fair question. We'll be sitting down to negotiate, and, you know, I don't expect the Health Secretary to come on your programme and state a figure live on air. I do expect him to get round the table and negotiate with the nurses, and that's what I would be doing. I think the nurses have been very reasonable, actually. Before Christmas, they offered to cancel their own strike action just for the prospect of talks on pay. And since Christmas and the government's refusal to negotiate, the nurses have said they're willing to meet the government halfway. I think they've been incredibly reasonable in the face of a very unreasonable government. And that's why Steve Barclay's got to go further than he's going today, not just get them in for individual chats, but actually have proper negotiations to avert strike action.
Well, listen, we'll see what the day brings. It could be interesting. Very quickly, just to take a complete diversion, we do read this morning that Labour is serious about wanting to ban smoking in the UK if you gain power. Is that a goer?
Maybe, Richard. We're consulting on a whole range of recommendations that were made to this government by Javed Khan, the former chief exec of the children's charity Barnardo's. He was asked by the government to do a review about how we tackle smoking in Britain, achieve the 2030 smoke-free target, which we're on course to miss, because at the moment, smoking is the single biggest cause of cancer, obesity, and other public health issues are costing the NHS billions a year. So as well as, going back to the old adage of prevention's better than cure, we've got to think about how we get our nation more healthy. I've got lots of questions about, this is what the government in New Zealand are doing, by the way, phasing out the sale of cigarettes altogether over time.
Yeah, the worry is, though, that you drive it underground, and you have the speakeasies that you had in America, except for smoking.
Yeah, I think that's a reasonable concern, Richard, and that's why we're consulting. We're going to look at what New Zealand's doing, but also consult on a range of other measures. I'm genuinely open-minded. I know this is a novelty in politics to have a politician saying we're consulting and it's genuine, but it's a genuine consultation. I did an hours-long phone-in on my LBC programme before Christmas, asking people where they stood on the issue, and I was trying to get a really good debate going, and interestingly, very few people were ringing in to say they opposed the prospect of a ban. So it's a genuine consultation.
Fascinating.
Wes Streeting, thank you very much indeed for your time this morning.